Welcome to the 2020 FMEC annual meeting special presentation about what leadership needs to know about student debt and its impact on physician wellness. I'm Joy Sorensen-Navarre, president of Navigate and longtime supporter of FMEC. So glad to be with you virtually today and very excited about your involvement on this important topic because I know from the work we've done with health systems and residency programs across the country that when leadership gets involved, then the physicians have a better chance at understanding their student loans and putting them into context for being able to manage them better, to reduce their stress and save them thousands of dollars. So welcome. I want to start by acknowledging I'm here in Minnesota. Sadly and tragically, this is where George Floyd lost his life, was murdered by the police not too long ago. It's also the place where resistance has grown up, and I'm part of work in our community to make sure that justice is done for George Floyd and that we work on the systems of justice, both in policing and community safety. And I know that we're not alone, that people across the country, including within the FMEC family, are also working for justice. So these photos are from Penn Medicine and their White Coats for Black Lives event. And so I want to thank you for what you're doing in your system. This is hard work. It's really important work, work that must be done if we're going to see justice prevail in our communities. So today, in the next 15 minutes, we're going to be talking about the risks that your residents face related to student loans. We're going to dig into solutions. We know that you want to know what can you do about this, and then we'll give you some free resources at the end. So, the student loan system is broken, hugely expensive to go to medical school these days because of the huge high interest rates. So if your residents have $300,000 in medical education debt, and that number is in the middle of the road, we see $250 to $450 all the time, sadly. But if there is a $300,000 balance, the monthly payments on those, on the standard 10-year plan, are over $3,000 a month. So the financial pressure that your residents are feeling is real. And this is why they're telling us that they're feeling stressed out. Dr. Julie Phillips does research on physicians and student loans. She's finding they're showing signs of depression. They're putting off major life decisions, and they're regretting their choice of specialty. Big problem for those of us that love our family medicine doctors. All right, so there are some things we can do. There's also impacts on health systems. We're seeing increasing costs for the system itself and the departments. And sort of the underlying problem for all of these is the stress that our residents are facing. And again, Dr. Phillips is seeing that in her research that there's an impact overall on the health system, because the fact that a physician would have a student loan is showing to have a negative impact on their practice of healthcare. So now this is an impact that impacts all of us, me as a healthcare consumer, you as a leader in the practice, our physicians who are doing the work, and our residents who are in training. So I'm really glad you're here today and that we're going to be working together to flip the script on student debt, we like to say. And it can be very easy. It's all about good education and then individually tailored student loan advice. And those two things together act as self-care for your residents related to their student loans. So I'm going to tell you a couple stories about what some of your colleagues have done and might spur within you some ideas for your own programs. So Allegheny Health and Dr. Amy Crawford-Forche a few years ago had us come out. She put together a collaboration within her system of the family medicine residency program, the emergency medicine, and I think it was anesthesiology. And they had us out for 2 days. We did presentations to each of the departments, and then we worked individually with any of the physician there who wanted to have an individual consult to know what they can do about their own student loans. And then we calculated the savings. And after working with all of those folks, they are now on track to save over $3 million on their student loans. Oh, unbelievable. It was just great to have that opportunity to collaborate with Amy. Those physicians saved from $40,000 to $400,000 each of them on their student loans. So these are huge real dollars we're talking about in terms of what it can mean when they get expert advice on their student loans. And then happily for everybody, FMEC has entered into a revenue share agreement with Navigate. So anytime that your department or an individual physician purchases our services, part of that revenue goes back to FMEC. And it's Navigate's commitment, my own personal commitment as the owner of this business, to support family medicine and the amazing work that FMEC does. We're thrilled to be part of this, and just wanted to share that with you. Okay, so here are your options. If you're wanting to do something about the student loan problem for your residents and for the program, the first that we'll do today together in the next 10 minutes is you're going to know the basics. So you're probably already smart on these kind of things because you came to the presentation, but I'm going to cover just the basics that you need to know so you can have a great conversation with your residents about student loans and feel like you've got the jargon and you understand some of what they're talking about and learning in other places. And then two things you can consider bringing back to your programs. One would be a didactic seminar on student loans that we would be happy to do for you, and then individual consultations for your residents or your faculty. And one of the handouts on the website, the FMEC conference website, is our fee schedule, and could tell you more about the details and what it would cost to do those things, or give us a call and we can talk more. Okay, so here's what you want to know. Right now, anyone that has a federal loan, because of the recent legislation that was passed and the presidential memorandum, the interest rates have dropped to 0. So anyone with a federal loan right now is accruing no interest. It truly is a miracle. We've never seen anything like this before, but it's happening right now. And that's going to be extended. It was extended through the end of 2020. So through December 31st this year, interest rates will remain at $0 on federal direct loans. All payments have also been suspended. So any of your residents or faculty that are in repayment, or perhaps yourself, you may have noticed you have not been getting a bill lately. You can opt in to make a payment if you'd like, but for most people who are pursuing public service loan forgiveness, for example, it's better not to be paying, because every month of those suspended payments will count as a qualifying month towards public service loan forgiveness. Like I said, miracles. We've never seen this kind of relief before, and really happy for it. All right. The other thing you'll want to know about is public service loan forgiveness. And this is the biggest issue right now about public service loan forgiveness. Let me just back up and say what it is. Public service loan forgiveness is a free federal program that is a terrific option for a lot of your physicians, because it'll dramatically reduce the amount they're paying every month and overall reduce what they're paying on the lifetime of their loans. They'll be done paying within 10 years, and they'll be able to get on with life and be done with their student loans. There are a number of criteria for that, and they are very specific criteria that people don't want to miss. So this is what you've seen in the news, perhaps, that many people have applied for loan forgiveness, and a tiny 1% or less have actually been granted forgiveness. We do know physicians who have been granted forgiveness, so it does work. We know that for sure. And what happened early on, the rules were not clear. People did not know what the program requirements were. Today, the rules are very clear. They're very specific, and all of your residents will know are able to know what they are. And one of the handouts I have in their program is the 3 qualifying factors for public service loan forgiveness. And so if people are wondering what they're required to do, send them to the PDF handout in the student loan section of the FMEC conference this year. All right, everyone we're working with is in the green because we're checking with them to make sure they're meeting the criteria every month when they're making their payments. All right, so if you hear people say, oh, it's not working, it is working. And it is something they can count on if they've got everything set up correctly and continue to do things correctly throughout that 10-year period. And this is why people use it, because of the huge savings. So if you look at the third line down, the principal and interest paid, this is Susan. She had $275,000 in student loans. On the standard plan, she'd pay back in 10 years and she'd pay $375,000 on her student loans. But instead, with a repayment plan and public service loan forgiveness, she would only pay $162,000. That's on the far right column, the third one down. So instead of paying $375,000 on her loan, she would only pay $162,000. So a huge relief on student loans because they're working for a qualified employer and they're following all the regulations to achieve forgiveness. Can be a fabulous solution for folks. So please let your folks know that it is totally something to consider. One of the downfalls of public service loan forgiveness is that loan servicing companies are making tons of mistakes. And so there's a big hassle factor. Takes time, takes energy, takes bandwidth, can be really tough for people in residency that are really busy. One of the things that we provide for our clients is that we get on the phone with them when there's a mistake and help them figure out how to fix it. So we are here for them, is what we always say. You can be a rock star for your residents, even if you choose not to do anything else except come to this meeting today. You can be a rock star by helping them fill out their employment certification form correctly. So if your residency program is within a nonprofit organization, their monthly payments will qualify for public service loan forgiveness, but they will want to send in an employment certification form. I have one of these forms also attached in the handouts, and so please get it. I'm happy to walk you through it. It's very simple. The resident fills out page 1. Your organization would fill out page 2. It needs to be very carefully filled out, otherwise it'll be rejected and it'll cause them more problems and hassle. So if you have any questions, or your HR department or your coordinator has any questions, please reach out to me. Happily, I'll have a 5-minute phone call with you or them and make sure it gets very clear. All right, FMEC has a $1 million challenge again this year. We are meeting for free by phone and computer with anybody within the meeting, and for 15 minutes to answer any of their questions that we can during that time. And then we're going to add up the amount of money that we've saved them and cumulatively hope to reach $1 million in savings. Well, I hope so. I hope so. It's a big challenge. So please, if you have folks here at the conference of your residents, please have them connect with us. Navigate.as.me/FMEC-2020. That's how they can get an appointment scheduled on our books. We are really excited to be talking to as many people as possible because we're trying to help people save, have the information they need on their student loans, and save a boatload of money. All right, if you have more questions, please reach out to me. I'm happy to be your personal resource for your department on student loans. That's my cell phone, so feel free to send me a text or email me. We get back to you very quickly. All right, here you go. Those are our sources. But yeah, have a great meeting. So glad for your leadership in your program and possibly at FMEC. We wish you all the best.